Good evening, ladies and gentlemen. I'm Dr. Dan Eli Aniku. I'm a consultant obstetrician. I work with Bloom Women Health. Today I want to discuss with you a very common subject, that is a issue of polycystic ovarian syndrome. Oftentimes we come in clinics and we get patients who come with different symptoms. One of the common presentations in most gyne clinics is the polycystic ovarian syndrome. What is polycystic ovarian syndrome? Polycystic ovarian syndrome is a common hormonal condition that affects women in reproductive age. And because it's a common thing, it tends to affect actually women in all categories of ages. One of the common symptoms of patients with polycystic ovarian syndrome is usually weight gain. Meanwhile, there are those who have acne, what you would call pimples, and then there are ladies who have excess hair all over their body. Some have male pattern hair distribution, and then ladies who present with baldness, which you would call alopecia for this case. Meanwhile, there are patients who can present with psychological symptoms such as mood swings. Some have problems sleeping, what we call as sleep apnea. Some get fatigued easily. So those are some of the common symptoms of patients really we see who have polycystic ovarian syndrome. So how do we diagnose someone who has polycystic ovarian syndrome? Generally speaking, when we are making diagnosis of polycystic ovarian syndrome, we are interested in three important characteristics. One is the menstrual irregularities, which I told you can either be periods take long to come or some do not see their periods. Two, the patients have features of hyperandrogenism, what I described as male features, either excess hair in their body, some have male kind of beards, and then some are a bit more virilized. And then thirdly, to be able to diagnose polycystic ovarian syndrome, we have to do a pelvic ultrasound. And during the pelvic ultrasound, we would be able to realize that they have what we call as polycystic ovaries. And there's a particular pattern of ovaries, ovarian cysts that we call, which we think are polycystic. The cysts must be more than 12 in number in one or both of the ovaries, and usually they are within the sizes of 2 to 9 millimeters. Not every time if a lady has some kind of ovarian cyst, then she has polycystic ovarian syndrome, even if other features are there. So usually for us to be able to make a clear diagnosis, there is something we call as Rotterdam criteria. In Rotterdam criteria, we consider two of those three characteristics which I've talked about. So you must either have menstrual irregularities alongside features of hyperandrogenism, or you can have menstrual irregularities alongside features of sonographic features of polycystic ovary, or the other way. So that is how we make a diagnosis of polycystic ovarian syndrome. So how do we diagnose polycystic ovarian syndrome? That is a clinical diagnosis, but at times you want to do investigations to be able to arrive at your diagnosis. So when we usually want to do further diagnosis, we want to have the results for the hormones, and I'm going to tell you the kind of hormones we want to evaluate. Two, you want to have your pelvic ultrasound with you. So what hormonal tests do we do for patients with polycystic ovarian syndrome? Because polycystic ovarian syndrome is multisystemic, And we told you that most of these patients have what is called insulin resistance, which is actually the reason why they usually have a weight gain and other features, the male features, because when there is there's a high degree of sugar levels within the body because of hyperinsulinemia. What happens is that it affects the liver's ability to produce appropriate sex binding hormones, and when the liver is unable to produce the necessary sex binding hormones, then what happens is that the testosterone levels tend to rise up because now they are not well bound. So that is how the problem of a lot of hair in the body, that's how it arises. So how do we manage a patient who has presented with polycystic ovarian syndrome? One of the things we have to do is to investigate them. So we've done an ultrasound, you have either got the polycysts are there or not. That in itself is not enough. 2, you have to do hormonal assays. So in hormonal assays, you want to do several blood workup. Because some of these ladies don't see their periods, at times the problem may not be necessarily the polycystic ovarian syndrome. So you also want to rule out other things which can make people not to see their period. For example, high prolactin levels, because the women with high levels of prolactin cannot be able to see their period, so you also want to do a test for prolactin level. The same applies to thyroid function test, because thyroid is a very important hormone for metabolism. You want to see that whether the levels of the thyroid hormones are high or low. So we also do a thyroid function test. We want to check for follicle stimulating hormone and luteinizing hormone. These are hormones produced up in the brain and they help to stimulate the ovary. So you want to be sure that the brain function is intact. The pituitary is releasing the necessary hormones required for somebody to be able to have their periods regularly. Besides that, you also want to do testosterone levels. I told you that most of these patients present with features of hyperandrogenism or male features. So we want to do a test to rule out if they have high levels of testosterone. So we do both total and free testosterone levels. There are also other blood tests which you can be able to do. For example, you want to rule out that this patient, the male features are not necessarily just because of polycystic ovarian syndrome, or the other conditions like congenital adrenal hyperplasia. So to rule out conditions like congenital adrenal hyperplasia, you can also be able to do other tests, like for example 17 and hydroxyprogesterone, to be able to rule out that. Once you're able to do that, then it can be able to guide you what you're dealing with. You also want to do glucose levels, fasting glucose level, because most of these patients usually have some kind of high levels of glucose. You want to check for the lipid levels. You want to be sure that they're not, having other complications, because most of them usually present with obesity, overweight, they're obese and this kind of thing. So you want to be sure that they do not have other problems related with the overweight. So coming to the actual management of polycystic ovarian syndrome is based on the goal of the visit of the patient or the client. In my experience, there are times when I receive very young ladies, either from the university or students. Their biggest concern is maybe they have a lot of acne in their face. Meanwhile, there are those who come to you, they tell you, my biggest concern is the hair and the beards that I have. And then there are those who come to you with obvious features of failure to conceive. Meanwhile, there are those who are concerned about not seeing their periods. So every time you have a client in your clinic, you should be able to establish the goal of the visit. Once you establish the goal of the visit, then you individualize care. One of the most important steps that we require every patient to consider usually is to get into lifestyle changes. This may involve feeding appropriately to be able to reduce the excess weight gain, and then coupled with feeding would encourage them to do exercises. At times, just cutting down weight after exercises alone can actually be able to restore the normal cycle of some of these patients. So we encourage them to do exercises. We encourage them to have a kind of feeding plan where they can be able to reduce weight. I told you that most of these patients have some kind of insulin resistance, therefore insulin levels goes high up. So for this category of people, we usually give them insulin sensitizers like metformin. And because metformin is commonly used in diabetic patients, at times the patients, while they reach home or meet other people, they'll say, "But why are they giving you diabetics treatment?" So, but in reality, metformin is just an insulin sensitizer. It's a very important medicine to improve on the liver function so that we can be able to mop up the excess sugar within the body. And then, besides giving people things like metformin, there are those who have a lot of hair on their body. The common drug usually for removal of the hair is a flonithine. So that's a drug which we can be able to prescribe. And then also for those who have high levels of testosterone, at times we give them a drug like spironolactone, which is usually used in patients with chronic liver disease. But you must make sure that you follow up these patients closely, because at times the use of drugs like spironolactone can also result into destabilizing the potassium function within the body. So you must make sure that you follow them very closely. For those who have infertility, many studies have proposed that ovarian stimulation, especially with letrozole and clomiphene, can be sufficient to be able to induce an ovulation so that they can be able to conceive. So that's one of the things which we use usually to be able to ensure that they can be able to conceive. There are other more natural drugs which we can use, but there's another common drug. The most common drug doctors tend to use is the family planning contraception, and they use it commonly for those who want to have regular cycle. But I say that if somebody is having a regular cycle and wants to conceive, I would advise that you should use other more natural medicines that can be able to restore the cycle. One of the most important and a very good drug, it's a natural drug which can help in restoring cycle, is hyponate. Hyponate is a very nice drug. When you take it, usually 2 tablets, and for twice a day for like 2 to 3 months or even more, it will be able to restore all the functions. It works in all the levels of the pathology. It helps to reduce the androgen levels. It helps to reduce the insulin. It helps to improve rather the insulin sensitivity, and that way it can be able to restore the normal menstrual cycle. So I usually give my patients medicine called hyponate, but we also have drugs like polycystic ovarian disease pills, which are specifically Promember PCOD, which is specifically designed to be able to stimulate the ovarian function. Of course, there are those whom you just want to give them a drug like M2 which is also a natural method to be able to restore the cycle. So those are the medical approaches we have for managing patients with a polycystic ovarian syndrome. But also, we have at times we consider surgical option. Surgical option here means that at times the patients, when they have massive polycystic ovaries, at times you want to take them to theater, and we do a short procedure laparoscopically, what is called as laparoscopic ovarian drilling. So when we do the drilling, we'll be able to reduce the number of the excess production of the androgens, and that way it can also be able to stimulate the ovarian function. And there must always be precaution on how much you're able to do that, because excessive drilling can also lead to patients, it can lead to completely affecting the ovarian function. So we have to be extremely very careful. Ladies and gentlemen, if you want to get personal touch with me, you can be able to write to me, an email or text me on WhatsApp number. I'll be able to get back to you for better individualized care. And for those of you who have never subscribed, please, I would request you to subscribe so that this video reaches to so many people. If you like, and comment, and if possible ask questions where I'll be able to respond back to you at least within 24 hours. Thank you very much.